Hello everyone, welcome back to my channel. My name is Marion. If you have been following me in my channel, I've been doing the CT Registry review. You can also use my review for your CQR as well. In today's PowerPoint presentation, I have a list of review questions and answers along with the explanation for you. For this section, it will be for patient care, and then I will make review questions for other sections. I just wanted to keep it separated, keep it organized so no one would get confused. So these are the questions. First, you will see the question, you will see the choices, and then you will see the answer. So if you need to pause this video, feel free to pause the video as we're going through. So for question one, which of the following examinations should be scheduled before an imaging procedure and that requires oral contrast or barium? So you have your CT head, CT neck, CT abdomen exam, or CT foot. And then you can also pause it between because I'm just going to go to the next slide and give you the answer. So I just give you a little time to think. Okay, for the answer, if you chose CT abdomen, that's correct. And the reason it is a CT abdomen, that's because CT exams of the chest, abdomen, and pelvis, it should be scheduled before an imaging procedure that requires you to have oral contrast, such as barium. So these exams should be scheduled after the barium has passed through the bowel so that it can be cleared of contrast. So it won't cause any streaking or artifact on the exam. Okay, question two. Who is responsible for explaining the CT procedure to the patient? So giving you some time to think. Okay, here's the answer. The CT technologist. So although you have scheduling, you have them going to the front desk, seeing them, CT Tech, so we are still responsible for giving the patient clear instructions, telling them what to expect, how long the exam would take, what to expect during the exam. Will they have to hold their breath? Will they feel contrast going in? Whenever the contrast is going in, what type of sensation they will feel? We have to tell patients all of this, so it is our responsibility to let the patient know. Okay, question three. If an IV contrast study is ordered, the patient should be instructed to do what? And once again, I'm just going through the questions, but you can just pause the video to read the questions. Okay, a patient is instructed to empty their bladder before starting the CT exam. Here's the reason why. Whenever you have a patient and you get them to the department, they could be coming from their bed or their floor if they are an inpatient and you work in the hospital. You get the patient all the way down, they get on the table, and then they feel like they have to urinate, or they can't get up and they need a bedpan. So if they would have known that the contrast may make them feel like they're urinating on themselves, or even if they would have known that they are coming down for a CT, just communicate with the nurse if you work at a hospital and tell them to have the patient use the restroom in their room, or if they are an outpatient, just ask them if they need to use the restroom. Okay. Question four. Before giving CT contrast to patients, what instructions should you let the patient know regarding the feeling of having the contrast? In between, I'll just pause. I won't say anything. I'll just let you read the answers and the questions or the choices, and then I'll read the answer. Okay, answer metallic taste. So whenever you have a patient, you start their IV, you tell them about their exam, let them know that whenever the contrast is going in, they will have a warm sensation going throughout their body. They will have a metallic taste in their mouth and the sensation of urinating. A lot of patients do not know this. they probably wasn't told, or they could have forgotten if they have altered mental status. So just remind them before you start. You can also remind them as it's going in. Check their IV site to see if they're feeling the contrast going in, making sure that it's not leaking. Because if a patient is surprised about what kind of contrast is going in or the feeling, they're gonna move. They will probably even panic, and it's just going to mess up the images, and it will increase their chances of falling off the table. And we do not want that. Okay, question 6. Which type of consent is used whenever the procedure is fully explained, including the risks, benefits, and alternatives, in a language that the patient fully understands? And if I'm going too fast with showing the answer, you can just always pause the video. Informed consent. Patient consent is considered informed only whenever the procedure has been clearly explained in a language where the patient fully understands it. That means they have been told about the risks, the benefits, any alternatives. Question 7. Who is responsible for signing an informed consent form if a patient is a minor? The answer is a parent or legal guardian. So even if a child is in their right mind or if a minor is in their right mind, a parent or legal guardian still must sign the informed consent. Question 8. Which type of consent occurs whenever a patient is in need of immediate medical services but is unconscious or unable to physically consent to treatment? Implied consent. So, implied consent, this occurs whenever a patient is unable to make those type of medical decisions, but you go ahead and do the medical treatment and services such as X-rays, CTs, MRIs, as if they would have consented to that if they were able to do so. So, if you work in a hospital setting, or if you are already working in a hospital setting, then you know in the ER department, a lot of patients come in that is trauma patients. They may have just gotten into a car accident, motorcycle accident, fell, whatever, and they cannot speak. They cannot tell you if they are allergic to iodine or not. We still do the treatments on them, the CT scans. You check their chart. You hope that a family member can tell you if they are allergic to contrast or not, but you still have to rule out those CTs, X-rays, MRIs. Even if the patient's not telling you, you may have someone who is worried about a bill, or, you just have to do the scan because you are saving someone's life. And I'm sure if they were able to, they would say, yes, you can do this X-ray, CT, or maybe even surgery. Question 9. Which of the following is a form of immobilization that is required and acceptable in order to prevent image motion caused by patient motion? The correct answer is breath holds. So, whenever a patient has something like a CT chest, abdomen, the machine will tell them to hold their breath. That is immobilizing the patient in a way so that they are not moving their body whenever they do have to hold their breath. But also, if you do have to stabilize a patient's head or arms, you can use the kind that is made or came by the facility, which meaning you use the machine's cushion, straps, or any other safety devices. You cannot take Coban or your own sheet and wrap a patient's arm or head with that because that's not safe. So just use what came with the machine. to just create a safe environment for the patient if you have to immobilize them. Question 10. All of the following is considered a normal level of consciousness for a patient, except which answer? If I'm moving too fast, pause the video, okay? Drowsy. A patient who is awake, alert, and responsive is considered to have a normal level of consciousness. Question 11. What is the medical term for a patient that is drowsy? There you go. This term, lethargic, means a patient is drowsy, but they can be aroused in this state. So if you, or maybe touching their feet with a pencil, or you have a light shining on their eyes, they can be aroused even when they're in this state. A coma patient is a patient that is what? Completely unresponsive. So if you work in a hospital, then you know a lot of ICU patients, not all, but most of them may come down and may be unresponsive. So not saying that that means the patient is in a coma, but I'm just giving you an example of just someone who's unresponsive. They're not responding. They can't tell you their name, their birthday. So make sure that you're checking their wristband and just checking their chart, checking with the nurse. Most of the time, nurses come down with their ICU patient, to keep them stabilized, make sure they're doing okay. So, also verify with the nurse. You can also verify the patient's name and date of birth with a family member as well. Question 13. Which of the following is not considered a part of obtaining vital signs? Medical history. You have your vital signs, which is your temperature, your pulse, blood pressure, and respirations. So, medical history is not considered a vital sign. You're just asking the questions about illnesses, surgeries, other health information. That is considered subjective, that is given by the patient. Question 14. Which vital sign reading is considered a normal body temperature? So this may or may not be a tricky one for someone. So I'll give you a little bit of time to answer this. All right, there you go, 97.9 degrees. So just keep in mind a normal body temperature is going to average between 97.7 to 99.5 degrees Fahrenheit. But also keep in mind, I always like to say when I'm using these numbers, medical is always changing. So this may vary depending on where you work at. New research and updates may come out, and this number may change. But just on average, it's going to be between this range. Which of the following is considered a normal pulse rate range for adults? Giving you a little time to think. All right. 80 beats per minute. That normal pulse rate range for adults is going to be 60 to 100 beats per minute. And once again, this is medical. It's always changing, it's always updating. So this is just a range. Question 16. What is the normal pulse rate range for children? Feel free to let me know in the comments if any of these questions are kind of tricky. If you feel like, oh wow, I didn't know that. I learned something, so just let me know. 110 beats per minute. A normal pulse rate range for children is anywhere between 70 and 120 beats per minute. I always throw out the disclaimer whenever I'm using numbers that medical is always changing. Different research may come out, a book may be outdated that has this information in it. So it's always changing and updating, okay? Question 17. In medical terms, what does BPM stands for? Beats per minute. Question 18. The pressure within the arteries during cardiac contraction is called what? The pressure within the arteries during cardiac contraction. All right, your systolic blood pressure. So just keep in mind a healthy systolic pressure is less than 120, okay? What is measured during the relaxation of the heart? Keyword, relaxation of the heart. Diastolic pressure. So that number should be less than 80 if you want it to be a healthy diastolic pressure. The normal respiration rate for adults are 15 breaths per minute. The normal respiration rate is anywhere between 12 and 20 beats per minute. But for this question, the answer is 15 beats or 15 breaths per minute. The normal respiration rate for a child is 25 breaths per minute. And you have that normal range for children 20 to 30. But for the sake of this video or the question, is going to be breaths per minute. What measures the pulse and respiratory status? What instrument is used? Pulse oximeter. So if you work in a hospital, because you'll mainly do this in a hospital, if you do have to do this in an outpatient clinic, that may be because someone blood pressure is high, low, they have fainted, they may have had an allergic reaction, they could have fallen, they could have tripped and bumped something, hit something, maybe they're lightheaded. So whenever you see this, you can put the pulse ox on their fingers, toes, earlobe, anywhere where you can get a measurement. If you can't get their fingers as a measurement, I've seen it be used on their earlobe or maybe their toes. And instead of always using a pointer, try using another finger as well. A normal oxygen saturation level is 95%. That range is going to be anywhere between 95% and 100 for it to be normal. And just keep in mind again, it can be placed on the fingers, the toes, or the earlobe. Okay. Which term refers to the series of blood flow that is related to the beginning of one heartbeat to that of the next? Cardiac cycle, which is going to be the sequence of events that occur in the heart during a single heartbeat from the beginning of one beat to the beginning of the next beat. The relaxation of the heart muscle is called all right, diastole. What is the definition of systole? It refers to the contraction of the heart. Question 28. A graphic representation of the electrical activity of the heart is called graphic representation. What is it called? An ECG is going to be used in cardiac CT studies whenever we are evaluating that heart rhythm. So just keep this in mind. Just know how to read it as well, your PQRS waves. And I also have this lesson on my channel in my CT Registry review playlist. If I remember, I'll try to link it to the description part of this video. But you can also, that information is packed with tons of notes that I created, study guide notes. So you can also use these questions and that review video to help you as well. A patient that experiences a syncope episode has done what? Syncope episode. What have they done? Fainted. Syncope or fainting is a loss of consciousness that doesn't last long. 32. A systolic blood pressure reading of 150 is considered to be what? It's going to be high or elevated because that reading should be less than 120 for a normal reading. So anything that is 130 or higher, that's known as hypertension. Once again, this is medical. Numbers are always changing. Question 33. What is the normal bun range in adults? I'll give you a little bit of time to think. Okay, 7 to 25. That's the normal bun range for adults. And if you do not know, you use it to indicate how well a patient's kidney is functioning. Which of the following is considered a normal creatinine range? Is considered a normal creatinine range. 1.3. The range is going to be 0.5 to 1.5. However, like I'm always going to say this whenever I have numbers involved and throughout the disclaimer because it's always changing. So whatever facility you work at, they may give you a different range, but I'm using a certain review book or a certain website that's giving me this number. So this is what I'm going by. But also, if you work at a facility, they have their protocols in place of what their normal creatinine range is. And this can be due to updates, due to changes, new research that has come out. And also, if the creatinine range is above 1.5, 1.7, so forth, you need to reach out to the radiologist. Just say, hey, this patient is this, they are diabetic, they're not a diabetic, they have this type of scan order, they come in for this. Should I give them contrast or do you want me to reduce the dose or no contrast? They're going to either tell you, give it, see if they're going to dialysis. If they are diabetic, don't give it, change the order to without, or they would say reduce the dosage. So if you planned on giving them 100, then give them 80, give them 75, and you also should be using their body weight to measure how much contrast you're giving and their age. Which lab test is a more accurate way to measure renal function? Your GFR. If you do not know, there are two different websites that I like to use to measure GFR. I made a separate video on how to get to it. But if you need to know again, just let me know and I can just make kind of like a condensed video of just that to show you how to calculate GFR on the internet because you want to put in their age, their height, or their age and their weight. So I can show you how to do that if you don't already know. Some places, especially if you work in the ER, they're probably even skipping creatinine wherever you work at. So I know in trauma situations, if a patient doesn't have any kidney problems, if you work in the ER department, they're skipping creatinines and just going through and the doctor's signing off on this saying, hey, you don't have to do the lab. If you work in outpatient, you may or may not still be checking labs. So, which of the following is a measure of blood coagulation? I'll give you a few seconds since I'm sure the PT and the PTT terms can be a little confusing. PT, this is going to measure the blood coagulation. Question 37. PTT is used to do what? Why is it used? Detect abnormalities in blood clotting. So whenever I study for my registry, I focus on the material first, and then once you have mastered that material, then you can start focusing on the questions. Because if you just focus on the questions and answers, that may not be good enough to pass your registry. So master that material first, and then focus on your questions and answer, and also focus on the explanation. Everything that I'm putting in the explanation, don't just read the question and answer. Read why it is the reason because you reading why it is the reason I'm giving you more information as well on what to know, different terms, definitions, the ranges. So just read everything that I'm putting on these slides because it will help you pass your test. Question 38. Which test is used to diagnose deep vein thrombosis and pulmonary embolism? D-dimer. There are times wherever patients come in, whenever they have the lab results come back, their D dimer is elevated and they will get ordered a PE chest. So, whenever you are checking the orders, see what is the reason why it is ordered. That can help you as well on your test. If you see that a PE chest is ordered for the exam reason, it may say elevated D dimer. So, that's also a good way to learn and study as well. You always want to make sure that you're verifying your allergies, making sure that they're not allergic to iodine, even making sure that they're not allergic to latex or certain type of tape. That's also good as well. Verify the creatinine, the GFR, so that you can make sure that you are giving them the contrast and hopefully they will not have any problems. If they do have any problems, because people have allergies, At least it's not from the mistake of their choice says that they are allergic, but you failed to check. So just make sure you're checking the allergies with the patient and the chart. Which drug is used to treat diabetes? Okay. Metformin. We used to tell patients to stop taking metformin for up to 48 hours or 2 days. So just make sure that you're still checking with your facility on if they still want you to stop metformin, want the patient to stop metformin up to 2 days after they receive their CT iodine contrast. Which drug is considered an anticoagulant? I'll give you a few seconds. Humidin. Also know that it's called warfarin. This is used to reduce heart attacks and strokes. So whenever you're going back through this video, because I may have forgotten to mention it at the beginning, whenever you're going back through this slide and reviewing the questions on your own, and you're pausing it and you're studying it or whatever you're doing with it, you could be letting it play in the background while you're cleaning up, whatever you're doing with it. Make sure that you are knowing and paying attention to the question, the answer, and read the explanation. I can't say this enough. That's what I did to pass my registry. I read everything. I read the explanation because not only is it going to give you the answer, it's going to give you the reason for the answer and may give you extra things in between. Question 41. Which type of contrast media are salts that consist of sodium or meglumine? Ionic contrast media. This is considered your salts. Which type of contrast is less likely to produce adverse side effects? The non-ionic kind. So just make sure that you go back, you can review my patient care slides and know the different type of contrast media. I have them all listed on there. Know the different kinds. Which IV gauge or needle should be used for a CTA chest scan? 22, 18 gauge, 24, or 25? 18 gauge. For angio studies, you want to use an 18 gauge, 20 gauge, or higher, meaning you can even use a 16 gauge. Hardly ever see a 16 gauge needle used, although patients may have those put in them all the time. But as far as us being a CT tech, we're going to only use an 18 gauge, a 20 gauge, and a 22 gauge when we're starting IVs. But for your CT angios, use an 18 and a 20 gauge. Make sure that it's in your forearm, your AC. Even whenever maybe nurses have patients come in and they have a PIC line right here, they may have a PIC line. So it can be used in the PIC line as well. Just make sure that it's say 5 millimeters or whatever. It'll tell you how high it can go. If you see no CT, that means you cannot use that part of the PIC line. So for CTAs, it can be in the hand or the wrist. It's going to infiltrate or it can possibly infiltrate. I am to the end. I'm almost done. So, which of the following is considered a mild reaction to iodinated contrast media? This is your mild reaction. Hives. Still, I like to still contact the nurse. If a patient is in the hospital, you can contact the nurse first, And then, of course, if it gets bad, they'll let the doctor know and they can order some Benadryl or whatever. But if you're in an outpatient clinic, let the radiologist know that, hey, this patient's saying all of a sudden she's having a lot of hives and she's feeling, or he's not feeling good about this contrast. And then maybe they'll go from there and decide what kind of treatments they would give to this patient. A moderate reaction to contrast is what? Wheezing. So wheezing is considered a moderate reaction. It is usually non-life threatening, but always talk to your nurse, talk to your doctor, talk to the radiologist, and just let them know, hey, this patient is starting to wheeze, they're not feeling good. I like to go in the room whenever I am giving contrast to patients, especially if it's a chest, if it's an abdomen, those type of exams where the delay is long. But if it's like a CTA, you can't stay in the room because the delay is probably 8 seconds, maybe even 10 seconds. So that's not enough time for you to leave your chair or leave the computer, then run inside, run back out, start the scan. So most of the time, you'll probably only check, or you should be checking if it has a longer scan delay, like a CT chest or abdomen. Well, this is it. You made it to the end. Thank you all for watching this video. This is the first set of questions. I have more to come. If you have anyone that you know is studying for their CT registry, this is also used for your CQR as well. So you can use this information to prepare for both. Feel free to share this video so that it can help someone. I hope that it's helping you. Feel free to leave any comments. Any comments if you have any questions, if you're still confused about something. If you found that this video is helpful, give it a thumbs up. Other than that, thank you all for watching. I will see you on the next video, okay? Thank you.